I think one of the things that's important when dealing with the patient is patients want to be heard. They want to be listened to. They want to know that what's going on with them is important to you, so you have a full understanding of what's going on with them so you can do the best thing you can to try to make them better. Individuals who have injuries, have ongoing pain, it's difficult for them to sometimes function or enjoy their life. We try to give them tools to try to cope with things so they can get back to enjoying their life as best they can again. Hi, my name is Dr. George Leimbach. I'm a physical medicine and rehabilitation physician, or also called a physiatrist. I practice at the Center for Spine and Orthopedics in Thornton, Colorado. What I do basically is a lot of non-surgical orthopedics, try to restore people to their maximal level of function. Of the things we do to try to get people better, we employ all different kinds of interventions. We use physical therapy, home exercise programs. Beyond that, sometimes we have to intervene with injections. We do different kinds of spinal injections. We've been very pleased with the success we're having with PRP and Stem Cell Injections in terms of regenerative medicine, in terms of curing different conditions where before we were only able to palliate the person's pain. Now we're getting some very successful results in terms of people getting better. One of the most important things is trying to make an accurate diagnosis, to put the pieces of the puzzle together as best you can, particularly with some patients who may or may not be able to completely have 100% recovery. At times you can't necessarily cure the patient, but at least you can try to do everything you can to maximize their level of function and improve their quality of their life. I like being outdoors, doing things outdoors, hiking, biking, golf, riding my motorcycle. One of the things I enjoy about motorcycling is that you're immersed in the environment versus being in a car. It's like you're really in the outdoors. I grew up in St. Louis. Baseball-wise, the Cardinals are my baseball team. I enjoy watching hockey. I love the Avalanche. Have followed them ever since they first came to Denver on. One of the changes I've seen in Denver that I don't care for is the amount of traffic we have these days. Certainly the city has changed. When I'm stuck in traffic, typically I just listen to music and try to relax. I enjoy music. Radio station-wise, typically listen to KBCO. Different genres of music that I enjoy, rock and roll. At my age, Beatles were part of everybody's life at that point, and so I just enjoy their music. I enjoy more modern music as well. I think family is one of the most important things in your life. It's nice being around people you're comfortable with and care about. Bethany writes, Dr. Leimbach is outstanding. He is intelligent. I trust him wholeheartedly. He has done many of my injections and did my discogram on me. I'm shocked how gentle he is. Other doctors I have been to make injections a bad experience for me until I find Dr. Leimbach. It is hard to find doctors nowadays. When I see a positive review, it makes me feel happy. It makes me feel fulfilled that I'm doing something to improve somebody's life. I'm very grateful that we are able to help people and that we're able to give them good care. Looking back, going through college, I was initially an engineer. Started looking into medicine, became very interested in different issues with medicine, went to medical school, and then fell in love with clinical medicine and taking care of people. In terms of some of the different tools we use to try to diagnose pain or orthopedic conditions, include x-rays, MRI scans. One of the things I do as part of my specialty is do electro-diagnostic medicine, which more commonly are referred to as nerve conduction study and EMG studies. So we can diagnose nerve conditions to try to get the accurate diagnosis and see what the most appropriate treatment is. These days, there's a lot of popular press about stem cell injections, PRP injections. I think in certain conditions they can be very helpful, but it takes a careful selection process to know whether they're really going to be beneficial for an individual. I think one of the things we have that's unique here at the Center for Spine and Orthopedics is we have a very close collaboration between non-surgeons, physiatrists like myself, and the surgeons, spine, general orthopedist, and podiatry, so we can pick the most appropriate care that's going to improve the patient's life. My name's Dr. George Leimbach. I look forward to taking care of you and giving you the best quality of life you can have.